All right, I'm here with Howard Reel with Johns Hopkins Hospital. Tell us what your role was here in the building of this hospital.
Yeah, my role is Senior Director of Facilities Design and Construction. I was responsible for certainly the construction of the building, bringing the design to a conclusion, permitting, contract awards, equipment, furniture awards, and execution. And then finally, with the activation of the building, working with my staff on the...
And what was the size of the project?
The project's 1.6 million square feet. It's $1.1 billion budget. That's an all-in budget, including all equipment as well as construction. It's on a 5-acre site, so a bit of a postage stamp size site in the city, which certainly brought its own challenges with it as well.
Well, we appreciate your comments on the panel today. What were your impressions of the discussion today?
Well, my impressions were I'm definitely the tactical arm of this organization and not the strategic arm. I thought the discussions were wonderful. Certainly brought an insight, I think, to me as a member of the hospital team. And I thought it was tremendous to share with people their experiences over recent years. One disservice this project has done for me, if you can call it that, is I've had to keep my head down for 10 years. So I haven't been out in the marketplace to see what's going on. So this is a little bit of a learning curve for me as well.
So as you look to the future with Johns Hopkins in the next 5 to 10 years, you've just built this new hospital, but obviously there are challenges and initiatives moving forward.
Yes, there certainly are, and part of my responsibility is also the capital budget for the entire hospital and portions of the health system. So from this project, one of the challenges it presented us, the project itself, is it depleted many of our capital resources. So over the next 3 to 5 years, one of our focuses is going to be to realign the available capital so that we can reinvigorate certain programs that had been started prior to the commencement of this project. So what I'm addressing are things like fleet replacements, where our hospital beds, we have 900 or 1,000 hospital beds. We usually replace 150 a year. Well, we had to stall that for a number of years. So we need to reinvigorate fleet replacement projects. We also have other buildings that are aged, and we're about to embark on a renovation of a 136 bed tower called the Nelson Harvey Building. So that presents some near-term challenges.
So what lessons learned on this project will you take to the next project?
Probably like a broken record. I do think that our silo approach to planning, sometimes a bullying approach to planning, we really need to get past that. We talked earlier today about how that seems to run rampant in healthcare environments, but it really is not to the benefit of the project.
Sure.
And I see that as actually, if between now and when I retire, if I could get past that, I think I would say I'd had a good run.
Right. Well, Howard, we just appreciate you letting us use your beautiful facility, and it's just probably the mark of your career. You're building this, and we just want to thank you so much.
Thank you very much.
All right, appreciate it.
Take care.